do. The amount of time to wait between one escalation and the other would be 4 weeks of a minimum, because you want to avoid adverse effects. So if you need to go from a 2.5 to a 5, or from a 5 to a 7.5, there should be a 4-week gap. But as you can see in all the cases that were presented, no one had to reach the 15 milligram dose. So always individualize your treatments. Please give your patients, if they are responding to whatever dose they are taking, don't be keen to escalate the dose, because we always want to give the lowest effective dose. That's regarding escalation. Combination of 2 doses. So what I can tell you in the studies, in the trials, they did not have to combine because they had the medication, right? They had the 2.5, it was available. They had the 5 milligram, it was available. They had the 7.5, they had all the different doses that were available. So if you do that, it is not what is in the studies, but if the medication is not available and you have to do something, then it is the same medication and you do as you see fit. Now, regarding the legacy effect, so to speak, it is not a legacy effect. So these drugs do not have a legacy effect. The fact that you have a 2-month layaway before you start gaining the weight, it's because that's about 4 to 5 half-lives that you get before the medication is completely out of the system, and that's why once it's out of the system, you will gain the weight. Now, when you talk about legacy, or when you talk about why do you want to give your patient a drug holiday, we are not interested in giving anyone a drug holiday, because as far as our data shows right now, there is no harm in continuing the medication, and there is no benefit of giving drug holidays. So when we do that, for instance, with bisphosphonates, where we give patients a drug holiday after 5 years, it's because we know there is harm if you go continue after 5 years to give a bisphosphonate. But with these medications, I do not see any reason with giving a drug holiday. The last thing that you mentioned was, what was it? I think, what was the last?
Withdrawal. I guess you already mentioned that, the withdrawal from the medication.
Oh, the overweight, the pre-obesity. I don't like to use the word overweight. It's a pre-obesity range. Actually, the medications are approved for pre-obesity with complications. So you start with a BMI of 27 and above with complication, not with a BMI of 30. A BMI of 30 is a must with or without complications.
Say you have any comment?
Yeah, just quick comments.